Now let's move on to a topic where guidelines have been evolving.
Okay.
I remember being taught to never use cuffed endotracheal tubes in young children.
Right.
But things seem to be changing.
You're right. While uncuffed tubes were the standard for years, cuffed endotracheal tubes are now recommended for patients of any age. This is because they provide a better seal, minimizing air leaks, and potentially reducing the need for tube exchanges.
That makes sense.
Okay.
A better seal means less risk of air leaks and aspiration. When would that be especially important?
Think about procedures like laparoscopic surgery or in patients who are prone to aspirating. In those situations, a secure airway is critical.
But what about the risk of airway injury with cuffed tubes, especially in those tiny airways?
That's a valid concern, especially with older cuff designs. But the development of low-pressure cuffs has significantly reduced the risk of airway trauma. This makes cuffed endotracheal tubes a safer option for all patients, even younger ones.
That's reassuring to know. So does this mean cuffed tubes are always the best choice?
Not necessarily. Individualized clinical judgment remains paramount. We still need to weigh the benefits of enhanced airway control against any potential risks on a case-by-case basis.
In children, uncuffed endotracheal tube size can be estimated using the formula 4 plus age divided by 4. The suggested cuff tube size is 3.5 plus age divided by 4. Regarding insertion depth measured at the lips, a common estimation is 3 times the tube size.